Basically add in the community, because it's a very important discussion, especially as Rachel is going to actually give you with the figures at the moment, in regards to how many people are in need of organ donation. Now, what I'm going to inshallah be discussing briefly within the time that we have, the aspect of Islam. What does Islam say about organ donation? It is a very touchy subject. There are aspects of it which we all need to understand, first of all, because what tends to happen is our first kind of understanding of organ donation is, whenever we ask people is, or is it permissible or not permissible, we tend to have kind of just outright not permissible. But it's rather it needs a rather in more in-depth discussion about this particular subject. So I think inshallah this opportunity will give us so we can discuss further and go into the deep into this discussion, inshallah.
Jazakallah, thank you, Muslim. Rachel, I think I'm going to ask you to come back online again, because we missed the mute button. So if you'd like to introduce yourself again.
Oh, right, sorry. Yes, my name's Rachel Wiseman. I'm a specialist nurse in organ donation, and I work for NHS Blood and Transplant. I'm based at Pinderfields and Dewsbury Hospital, and part of my role is to promote donation within the community around here.
Thanks much, Rachel. Myself, I'm Imtiaz Patel. Most of you should know me or will know me. I'm a local dentist by profession, for my sins, as you would say. With us also is Mohammed Laher, our in-house DJ.
Assalamu alaikum. I'm just the assistant.
Thanks, I'm very modest. Okay, Maulana, we're going to start off with you.
Right.
In a nutshell, we're going to go this in detail, but somebody must ask you the question. I would like to know if organ transplant are permissible from Islamic perspective.
Right. It's quite difficult to give an answer just in yes or no. First of all, we need to understand that transplant is a word used, but there's all sorts of transplants that we need to understand. One is auto transplantation. That tends to be tissues that are taken from one part of the body and transplanted to another part of the body, i.e. heart bypass. And you've got xenotransplantation, which cross-species transplantation, which is totally different aspect. We won't be discussing that here. And then we have homotransplantation, the transplantation of a tissue or organ from one human being to another, whether the donor is alive or declared brain stem dead. So it's basically the term used there is cadaveric transplantation.
So today we're going to talk about specific human organ transplantation,
right,
from the live to live person, and also from the deceased to the live person. Yeah.
Yeah. So when it comes to transplant, first of all, we need to there's blood transplantation. Now that tends to be the majority of ulama, whatever school of thought they come from, even the Hanafi school of thought, is that it's totally permissible, blood transplantation. There's no problem with that. When it comes
for a second, sorry to interrupt you.
Yeah.
You mentioned the Hanafi school of. Can you just briefly mention what you mean by the Hanafi school of thought?
The Hanafi school of thought, they are in particular. There's 4 schools of thought that are predominantly the majority of people in the world follow. The Hanafi school of thought, the Shafi'i, the Maliki, and the Hanbali school of thought. There are others who follow the Zahiri school of thought. They don't follow a particular paradigm that these 4 school of thoughts follow. They go beyond that, but even in most matters, they do follow the parameters that a Hanbali school of thought follow. So in reality, the reason I use Hanafi, because generally when we look at the discussion, and I will mention some of the fatwas that have come from all over the world, that they tend to be kind of permissibility is outright. There's not an issue about whether it's cadaveric or just a live donation. There tends to be an outright permissibility. When it comes to a particular our school of thought, in particular I mentioned the Indian subcontinent, there's more discussion, and that tends to be with the cadaveric. So the first one is as I said, blood transplantation. That's fine. Bone marrow, again, that's absolutely fine. Generally across the board, there's no issue about that. And when it comes to live donation, subject to certain conditions, for example, if it's a kidney transplantation, then generally even our ulama, our scholars have said it is permissible because of necessity. The key thing is necessity there. If someone's life is in danger, is about to lose his life, and you can give your own kidney because you've got 2 kidneys, so you can give 1 kidney, but the key thing there in the condition is you mustn't be in danger yourself. Your health must be 100% correct, and not going to affect you personally. So in that case, the ulama have stated that it's permissible But the key thing is live donation is there has to be certain conditions. When we get to the bit about cadaveric transplantation, this is where it gets kind of contentious. The majority of the Indian subcontinent scholars are of the view at this moment in time it's not permissible. But discussion is still ongoing. I attended a conference, as I said before, a couple of weeks ago, part of NHSBT transplantation, to get the message out into the community. And we had scholars from all schools of thought, Shia school of thought, Hanafi, Malik, quite a few people, ulama were present. We had Dr. Mahmood Chandia from Bolton, mashallah, and we had Mufti Zubair Butt as well who attended. And this discussion is about basically at the moment, what's happening is we have a pyramid system or three-tier system. Basically, we have the congregational people like us, and then we have our imams. We tend to refer any particular masla, any ruling to our imams. Now, our imams would usually, they would refer to a scholarly person, a jurist, someone of a high level, a mufti. So what it is this particular issue in Britain, in the context of Britain, England particularly, has not been discussed in depth within the high level of scholars. So this is something that NHBT is trying to go. So they're trying to engage with the senior ulama, mufti like Mufti Sajjad Sahab and Mufti Shabir Sahab and other scholars within the kind of the Deobandi branch. And then there's other branches as well. So to ensure that this is discussed fully, and if this is presented to them from a scientific point of view, especially there are professors, doctors who are working on this particular field, and they can give their particularly scientific, medicinal kind of aspect of it, then inshallah there will be progress made on this, inshallah.
If you just go break this up slightly, if you talk about the human life donation, right? The first thing you mentioned was blood transfusion. Rachel, when the person gets blood transfusion, something else, will it damage my own body?
Blood. I don't actually work within the transfusion sector. I work within the solid organ donation sector. But I can say yes, that a blood transfusion would not damage you. It is type matched to your blood type before you have one.
And the blood will go into a blood bank.
Yes.
And then, as and when necessary, they'll then use it.
Yeah.
What's the turnover of blood? Say, how much would normally a person donate, a pint at a time, or?
I'd have to say I'm not entirely sure about that because, as I say, it's not my field of expertise. Yeah. Although I work for NHS Blood and Transplant, I work purely on the organ donation side. So I'm not really expert to comment on just how much you can donate blood-wise. Sorry.
But there's a very big need for blood transfusion.
There is,
and
yes.
It's strong encourage people, all communities,
definitely,
of all background, race and religion, to come forward and give some blood transfusion. Yeah. Then moving on from there, we talked about life transplantation. Mother, you mentioned kidney transplant. Rachel, that's something which is probably your expertise now. 2 kidneys, a person can function perfectly well, up to 20% of the kidney function.
That's correct, yeah.
So do you want to elaborate on that?
Well, yes, I mean, my expertise is more in the deceased donation, but equally, yes, people can donate 1 kidney to another person. They would always be checked from a health perspective to make sure that both their kidneys were functioning well enough for them to be able to have good renal function with just 1 kidney. And they would go through quite a strict vetting procedure for that, and also to make sure that their tissue typing match was suitable for the person that they would want to donate to, which is usually a relative or very close friend. But yes, there are quite a lot of people now who do go down that route of donating to a loved one, because the transplant waiting list waiting for deceased donors is so long, and people wait for a considerable length of time in there that sometimes family members feel that is the better option.
And the kidney transplant can completely transform a person's life from having dialysis 3 times a week, restricted activity, to almost a normality of life.
They go back to a normal life, which is amazing when, dialysis is so restrictive to people's living.
What are you going to say?
Yes. Rachel, I just wanted to, just following on that, what kind of current statistics do you have in UK, especially around the BME community?
Yeah, well, I can tell you that at the moment, the active transplant waiting list stands at almost 7,000. So that's 7,000 people at this time are waiting for a transplant to save their lives. Out of that 7,000, almost 2,000 are from the BAME population, the majority of which are waiting for kidney transplants. There's almost 1,800 people from the BAME community waiting for kidney transplants at the moment. And unfortunately, those people do tend to wait longer than white people because they are more likely to get a donor from somebody from their own ethnicity because of the tissue typing. And unfortunately, because we get few donors from that background, they tend to wait on average twice as long, which is again why a lot of people go down the living donation route.
Maulana, is anything, as Rachel mentioned, is anything from the Islamic point of view, how we can sort of promote this if it's in the visible sort of Islamic environment?
In terms of promoting, it is quite, as I said, it's quite difficult in a sense. At the moment, there's obviously, as I said, figures show the how many people are in need of some, especially in particular kidney donation, and we don't actually realize until it actually affects one of us, our family member, someone close to us, and then you actually realize that something needs to be done. And then what tends to happen is our kind of knee-jerk reaction. You would go to a scholar and try and get them to you convince them that this particular aspect is in the situation you are in, it is allowed or not. So my is to go and actually educate people. I think the only way is through presentations and through radio programs and some kind of leaflets that we can produce to explain currently what the Islamic perspective is in live donations. So I think then you might get the message out to people, as opposed to you will get with respect to the ulama. Some ulama will actually disagree totally with what I'm saying. They might say it's not permissible, and my understanding is not permissible, and I respect their view. But when it comes to live donation, I think I've spoken to enough scholars, high-level scholars, who say it's permissible. Okay, necessity is the key. The key thing we must remember is we're saving life. If someone's life, we can save one person's life, as the Quran says that saving one person's life is like saving the whole humanity. So we really need to be doing that more than what we are doing at the moment, and that's why I think NHBT is trying to get a message, especially to the Muslim community, so that something needs to be done. In some ways, it's about educating. It's not about, we're not asking people to donate. It's about being aware of what is out there and what you can do to support in any way.
I don't want to go outside the boundary within Islamic point of view, but do you think there's like a confusion for people who are in need of that? Is it permissible? Do you think the ulama should sort of come together and come to sort of some kind of a balanced decision?
I think it's all to do with where you work. I think if you work in the hospital setting, you're working with patients, you see day to day the need. You'd have a different view. If so, obviously people work in different settings, so it's not for every alim, but obviously the high level scholars who have the understanding to be able to give a fatwa on this issue, then that needs to happen. Because the other thing is, I've met a lot of people who have actually had problems because they were in need of especially kidney transplant. So they went to the local imam or local masjid, and generally the view was, you can't do it, it's haram. This is the body, this our bodies belong to Allah, and we shouldn't be doing this. Understandably, it does, but we have to remember that this is out of necessity. And I will go through some of the points why out of necessity and some of the reasons that the scholars have said why permissibility has been given. Now, historically, in every masla, in every ruling, whenever science has come into it, there tends to be a kind of reserved judgment. You reserve judgment first of all and see the context. So if you look at the historical kind of fatawas, you'll always see that there's always been reservation or outright impermissibility. But as time has changed, even within the Indian scholars, one particular scholar has actually looked into this and in some ways given permissibility. So you will get difference of opinion. Ultimately, I think what tends to happen is what you, as a person, you've gone to a scholar and they've given you a view is permissible, then it's about understanding, are you doing something that you're saving a person's life? That's the key, really, to understand.
We're transmitting live, so if any listener outside wants to call in with a question, the number to call is 01924 505 629. If you want to call in but you want to send it by text message, you can do so on 07460 809 218. The WhatsApp number is 07460 809 218. I can call in live on 01924 505 629. Also, there's one question that's come in actually. He says on here, once the blood leaves the body, it becomes impure. So then the ruling around that. So I know it's not fair to put this on
I
the spot,
understand, but there's no, that ruling is not only applicable when it comes to leaving the body and touching the aspect of the external part of the body. So for example, the masla is, if something opens up here, right, and you can see the blood on the surface of it, the wudu does not break. It's not impure. It's only impure if it leaves that particular place.
Flows.
Yeah. So now here we're transplanting, from one person's body to another person internally. So there's nothing about impurity. It's like medication or an injection or any other thing. You're transferring. You can consider the blood as a medication. So if it's medication, if you can, because that's what you're trying, you're transplanting, you're moving from one body to another. That's why scholars have said it's permissible.
And the other question that's come in, most of the rulings we have are based on the Quran and Hadith, and as explained by the four sheikhs, Imam Hanifi, Safi. At that time, it wasn't even comprehensible that the organ transplantation was possible. So today's ruling is extrapolated from the writings, what they have said. Is that right?
Obviously, what happens is that modern medicine has actually developed in such a way that the scholars of today have actually looked in the context of a certain environment. We must remember, historically, for example, the Indian subcontinent, they didn't allow it because of certain conditions. Well, number one was because there was always a likely chance of people selling their organs for money to gain something at the end of it financially. Secondly, how was this particular operation, surgery done? So there was all aspects of it that we look around, and then the scholars at that particular time made it impermissible. But things have changed, obviously. Modern medicine has advanced to such levels where Rachel will actually explain to you how it happens. Even when someone is dying and decides to donate his organs, it doesn't mean that the organs will be given away. And there's certain procedure that needs to be followed, i.e. they'll be looking at the medical records, and I think it's only 1% of people can actually donate, isn't it?
Yeah, it's quite, there's 500,000 people on average die every year, but out of those, only 5,000 will ever die in circumstances where they're able to donate their organs for somebody else to live. And that's because the people who are in that unique position to donate their organs are people who die on intensive care units and in accident and emergency units, and they're people who have either been declared brainstem dead because they've had a massive intracerebral bleed or a traumatic incident happen to them, or they're people who have the medical staff have exhausted every line of possible treatment that they can offer them, and it's been decided that it's in their best interest to let them pass away. And because of those statistics, I think people often don't realise that you're actually much, much more likely to need an organ transplant than ever to be in a position where you would be able to donate.
So Richard, if I want to donate, so how would I go about doing that?
I would say the most important thing is to sign up to the National Organ Donor Register. There's currently approximately 20 million people on there, but yet that still represents not much more than a third of the population. So there's a lot of people who, when we ask them, say that in principle they support donation, but they've not got round to signing up. So we would say, join the National Organ Donor Register. You can go online to do that. And also speak to your loved ones and let them know your wishes, and that would be something that you would want. The way that my job works is that anybody on an intensive care unit or in an accident and emergency department who is about to pass away, the doctors and the nurses on those units would always ring myself or one of my colleagues, and we would always approach the family if that person was suitable as an organ donor. We find that if those discussions have been had in lifetime, and if they are on the organ donor register, that makes the decision-making process much, much easier for the families, and we're more likely to get a consent for donation to proceed.
What if in a situation, Parisha thought somebody was on a donation and then something happens and then say I don't want to go through it, or the family says we're not letting you. What happens then?
Well, unfortunately, we would always respect the loved one's wishes, and we wouldn't proceed because at the end of the day, the way we look at it is that they're the people who have to live with, you know, what's happened, and if it's going to cause rift within a family, then we wouldn't proceed with it. But we do make it quite clear that, you know, that was obviously something that that person wanted to do, and, you know, try and just get them to think about it a bit deeper before we would stand back from the situation. People often ask me, people who are signed up to the organ donation register often say to me that their loved one or next of kin isn't quite sure about it and what would happen if they were in a position to donate, and they said no. And I would say to them what I've just said to you, and they do get really quite angry about it because it is their decision and it's their wish. It's almost like a living will.
Thank you.
So going back to live donation, besides kidney organ, is there any other organs that can be given from a live person to live person?
Yes, livers. People can donate a lobe of their liver to a loved one. It's not as common as living kidney donation, but it does happen more often from a mother or father to a child. And there is a living liver donation programme at Leeds at St James's Hospital. And there is work being done for lobe and lung transplantation as well. So,
there's a question talking about necessity. It says, how does one determine when a situation falls under necessity?
Necessity is basically if someone's life's at risk and they're going to die. It's as simple as that. Where and now we have to determine if a doctor, whoever said that this person's life is in real danger, he will be dying. That is necessity. So it has to be, you know, life-threatening kind of illnesses. Then it's permissible. That's now. Let me clarify that. As far as my understanding is concerned, having done research on it, at the moment, live donations subject to certain conditions, it is permissible. Cadaveric donation, as I said before, which basically means someone who's dying, that is up to or donor having a donor card, and when you're about to die, you're saying that you will donate like a will kind of thing. Then at the moment, the ulama are of the opinion that it's not permissible. There are some ulama within even our scholars, they say it's permissible, but the majority at the moment are kind of still veering towards impermissibility. But that's up for discussion as we go along. So the things will develop, inshallah, in the next 5 years, and as more technology and science will advance, you'll probably see some ulama looking at it and be giving permissibility.
On the service of live donation, blood, milk donation, that is something that we regenerated.
Yeah.
Or kidney, liver, lung, which you mentioned, are not degenerated.
Yeah.
But as long as it does not affect the person who's donating, then permissibility is okay.
Subject to, and I'll mention some of the points subject to what is permissible. I've just got it here. Basically, it's only permissible if it's non-vital organs. So obviously, as you said, if it's anything heart or anything, then it's not permissible. It's got to be regenerative organs like blood, bone marrow. They obviously, as I said, they're permissible. Transplant only, that's the only viable treatment for that person who's dying. As there's other alternatives, then we don't go down that route. And you must remember the success rate for this particular transplant, if it's is quite high, then it will actually be allowed. Then it must be the consent of the donor. The donor must give consent, and no coercion or duress must be involved, and no danger of the person who is alive, his life being put at risk.
And no exchange of financial.
There's no financial kind of agreement or anything. It mustn't be involved in that kind of thing. So there are a lot of the conditions that are there for it to become permissible. And this is applicable obviously through blood, bone marrow, and live donations.
Mm-hmm.
When it comes to cadaveric, it's slightly different.
Yeah.
Rachel, what's the government's stance on organ donation?
Well, the government have quite a big drive at the moment to improve donation rates. a few years ago, because our donation rates in this country were not as good as other countries, and our transplant waiting lists were seeing 3 people dying every day waiting for a transplant.
Within the European country or within the
within Europe. When I first started in this job 6 years ago, the donation rates in the UK were approximately 14 people per million of population, and in countries like Spain and the USA, they were in the 20s and the higher 20s. So the government put a task force together to look at organ donation and look at the barriers to it and what we could do to improve our donation rates. My job as a specialist nurse in organ donation was one of the recommendations that came out, and every hospital throughout the country, every trust has a specialist nurse to help promote donation within the hospital and the community. There were lots of other recommendations, but another big recommendation was that every family whose loved one was dying in circumstances where potentially they could donate would be spoken to sensitively and offered that opportunity. And they set a 5-year target to improve donation rates by 50%. And I'm very proud to say that we actually did reach that target just over a year ago. And we did improve the donation rates by 50% and the number of organs transplanted by about 30%. Unfortunately, it still isn't enough. We still have a huge gap between the number of people waiting for a transplant and the number of people donating. And we still sadly have that statistic of 3 people dying every day on the transplant waiting list. So the government now has got a strategy to try and improve the consent rate. The consent rate currently sits at about 57-58%. And they're wanting to improve that to 80%, which is why there's now a lot of work being done within the BAME community and areas where we see very low consent rates to try and improve things further and, you know, do justice for those people that we're putting on the waiting list. Because really, if we're you know, putting them on the waiting list, we should be able to offer them a transplant.
We've got a text and it says, is it true law is changing that unless you have it in writing, your organs can be used after you die?
I think where that probably has come from is the new Welsh legislation. In December, the organ donor register in Wales is changing slightly in that unless you opt out, you will be seen to have deemed consent. So even people who haven't opted in, if they haven't opted out, it will be assumed that they are giving permission for their organs to be donated after their death. That is not true in the rest of the UK.
Oh, so that's only applies in Wales.
It's only going to apply in Wales, yeah, and it comes in December of this year.
Also, do you have any experience with any Muslim families in discussing organ transplant and donations?
I do, yes. I've got a handful of experiences of approaching Muslim families, and they've been very different. Some families have been adamantly against it and not wanted to discuss it at all when the subject has been brought up. But I've found in more recent years, the more recent families that I've approached, a couple spring to mind in particular, and obviously it's all very confidential, but they have sat and they have listened, and they've asked extremely relevant questions. They've said that, you know, sort of like talked about their loved one and said that they were kind people and they always wanted to help others. But ultimately, it's almost been like the decision-making process hasn't been theirs. They've gone away to discuss it with other people. And when they've come back, it's been a no. But they've almost been apologetic about that. And I just get the impression that within your community, within your religion, there's so many more people involved in that decision-making process. And it's not ultimately a decision just for the next of kin.
I think let's move on to the cadaveric transplants. Is the word you use, Malana? Yeah.
Yeah, cadaveric. Yeah, cadaveric is the term used. Basically means when someone is either dying or has passed away, and the organs most of the organs that I mentioned that are then donate it to whoever. Right.
Richard, can I ask you what the most common organs I didn't need from the cadaveric point of view? What's the biggest need? Which organ?
The biggest need is kidneys. The kidney waiting list is huge. And then after that, I would say livers, a very large liver waiting list as well in the UK.
And what other organs are used afterwards?
Hearts,
everything,
yeah, hearts, lungs,
Cornea.
pancreas, small bowel, corneas. Yes, corneas are then classed as tissue donation. So corneas, skin, bone, tendons, cartilage. There's lots of tissues that can be donated. But from a solid organ donation, life-saving point of view, it's kidneys, pancreas, heart, lungs, liver, and one solid organ donor can potentially save up to 9 lives.
That's quite significant.
Very significant.
Just talking about the kidney, is it more on the young side or the elderly when people who are waiting for the kidneys, for example?
Yeah, I don't have statistics for the age range, but the age range is huge. We do have children waiting for kidney transplants. Equally, we have people in their 70s waiting for kidney transplant. I wouldn't be able to give you a breakdown of ages. I don't know whether that is held in statistics at NHS Blood and Transplant or not. But we have quite a lot of young people waiting for lung transplants, in particular, young cystic fibrosis patients. And there is a huge need for donor lungs, and obviously they can only come from deceased cadaveric donors.
There's a question that says that, is it an act of worship, ibadat, that if one was to donate an organ, then that organ was to save or prolong somebody's life? Sorry to put it in this.
No, I understand. No, it's a good question. Alhamdulillah, it's a good question. It depends how you actually view the issue. If you view it from a permissibility point of view, then it's considered a very, very rewarding act, because you're helping, you're giving something that is precious to you away to someone else, and you are saving someone's life, or a means of saving someone's life. Our belief is that Allah will save the person's life. You're a means, so it's very rewarding. If you of the view it is permissible, obviously, if someone his belief is that it's not permissible, then he will consider that as a sin. So you will get a contrasting view in this issue, depending on where you actually stand, whether you consider it permissible or non-permissible. So I think to answer that question is, where do you stand? If the person considers this particular issue of donating as permissible, then it's very rewarding. It's not just permissible; it is a rewarding act. Actually, therefore, you're obliged to do it, as opposed to it's permissible. You're obliged to do it. Whereas the opposite point of view will actually say, if it's not permissible, then you'll be doing a sin. So I don't know if that's where you stand with regards to the masala.
I think the majority of jurists would today say that a cadaveric donation is not going to harm the person, obviously he's passed on. And majority of jurists would say that it is permissible to donate the organ, and therefore one should look at it in the context that it's an act of ibadat.
Yeah, I think this is where I think we're getting into a particular issue. Now, let me just explain why those people who actually consider it non-permissible. Okay, then there's 4 main reasons. There's actually a few others, but the main one is basically Allah Ta'ala has honored human beings. So we are all honored by Allah subhanahu wa ta'ala. Okay, so when we are honored by Allah subhanahu wa ta'ala, therefore we shouldn't in any way damage our bodies or harm our bodies, because Allah has honored us. The second reason that is mentioned is that Allah subhanahu wa ta'ala basically has said that it's impermissible for us to mutilate, cut our bodies. That's why post-mortems are not allowed in Islam, because you are cutting your body, you are harming your body, you're tampering with your own body. Therefore, for that reason, it's not permissible. The third reason that is stated is because ultimately this body belongs to Allah. So it is not for us to make a judgment whether we should remove this part of the organ or not. What should we do with it? That's not up to us. It's up to Allah subhanahu wa ta'ala. And the fourth reason they use is that ultimately what they say is that one harm cannot be removed through another harm. So okay, there's a harm here, there's a necessity here, but by doing another harm, you are So two harms don't make it right, basically, to allow it for it to be permissible. Now, obviously, these particular points of view, when it comes to mutilation, I think that's something that many ulama who are of the view that it's permissible have debated, because this word mutilation, how do you define mutilation? Because surgery is considered mutilation. When you do surgery, when you go for an operation, it's kind of you're cutting the body up, opening up. That is mutilation, by definition. So therefore, does that mean that you can't do surgery? So this is where it's debatable about mutilation and about the aspects of even, for example, the body belongs to us, but the answer would normally, the ulama would say that the ones that are considered permissible is it's basically medication. Whenever there's a medication, for example, in Islam it says pork or alcohol is not permissible, but out of necessity we would use it. Similarly here, out of necessity we would use the same. We have, if we have to, if that's the only choice, we have to save someone's life, then the scholars say it's permissible. So it's something that that you will, whatever you some people from an ethical point of view just consider not from that point of view not permissible. But as I said, I've done research and I've come to the conclusion, especially speaking to scholars that I am quite au fait with, and they have given permissibility, especially in these three areas. But when it comes to cadaveric, I think that's where you tend to have 2 points of view. But ultimately, I think what Rachel has said is the key thing is you've got to understand the person who is dying or who wants to donate, wants to do something good and leave something, a kind of legacy. Then it's really their decision. It's not for us kind of, especially if they've actually sought some kind of advice from a scholar, whether they agree with the scholar or not. They should really allow the person for that judgment to be carried out, as opposed to we as interfere with that person's individual judgment.
We I'm a little bit confused. We are allowed to have a donor organ, but there's a question about to give out. Is that what you're saying?
I think where my problem lies there, I think if I can say that on that point, is that it really is inconsistent and morally reprehensible if you consider that you can take the organ, but then you can't give. I think there's a huge disparity in a person's judgment that says you can take an organ, but you can't give. Then this is morally reprehensible if you make that decision. I am of the view that if you say it's not permissible, then it's not permissible either way. You can't take or you can't give and you can't take.
I agree.
And then so the same way that if you consider it's permissible to take, then you should really think, you should look at this way, that it's permissible to give.
There's no how can you take?
Exactly.
I think this time is 8:40 now. You have a 20-minute after 20 minutes, have a little break, but the conversation has been quite interesting. The time is 8:42, so we'll have a quick break if that's okay. Yep. Thank you.
Online and on your home receiver, you're listening to Radio IMWS. Hire the Al Hikmah Center for your weddings, functions and events, with segregated halls for men and women, including independent access, able to accommodate 1,500 guests, private car park with car park attendants, easy access, great location and full free Wi-Fi. There's no place better for your special day. For bookings and inquiries, call 01924 500 555 or email info@imws.org.uk or visit our website at www.imws.org.uk. The Al Hikmah Center, where your special day becomes a cherished memory.
Time to choose your child's next school. But which one? Choose the only Islamic school in Kirklees to offer nursery, primary and secondary under one roof in our fantastic building in Town. Choose a school which achieved 50% in GCSEs, including English and Maths. One which Ofsted deemed good with a number of outstanding features. Choose a school for its excellence in teaching, pupil care and achievement. Come and see for yourself what Madani Muslim School can do for your child at our open evening on Wednesday, the 30th of September, between 5 p.m. and 7 p.m. For further information, visit our website at madanimuslimgirls.org.uk. Madani Muslim School, a quest for faith and knowledge.
It is related by Sayyidina Anas radiallahu anhu that the Prophet Muhammad sallallahu alayhi wasallam said, when a man marries, he has completed half of his religion, so let him fear Allah regarding the remaining half. The Al-Hikmah Nikah service launched by the IMWS aims to introduce prospective marriage partners to help fulfill this important aspect of faith. The service is open to unmarried Muslims who are permanent residents of the UK. For more information, visit our website at www.imws.org.uk.
Radio IMWS.
Assalamu alaikum and welcome back. Today is Thursday, the 17th of August. Just a very few quick announcements to make. Tomorrow on the same channel at 8 o'clock, there's a program about choosing high school, and we'll have representation of the Madani Muslim Girls High School. Also, for those who want to give Qurbani, tomorrow is the final date. £14 per share or £98 for the full animal. There's a Unity Fun Day for men and kids, and that's on Sunday, 27th of September, 11 o'clock till 5 p.m. weather permitting. And let's go back to today's subject. Today we're talking about organ transplantation, and there's two very experienced people in their field, Maulana Aslam Sidat and Rachel. We've covered live organ transplantation, also from the cadaveric point of cadaveric organ transplantation as well. And we just talked about ethical issues that are around it. Rachel, what are the biggest barrier that you found when you talk to families, whether it be the BME or the wider community, when it comes to organ transplantation?
I think one of the biggest barriers is not knowing what that person wanted to do, which is why I said before, if you do support it, please make your wishes known. Join the organ donor register and make your loved ones know of that decision, because it makes the decision making process so much easier when you're talking about it. The other issues that people tend to have is what Aslam was talking about before, surgery to the body and that thought that it's mutilation. And I'd just like to reassure people that, as I do with any family that I talk to, that when people do donate their organs after death, it's an operation like any other operation they would have to remove an appendix, some diseased bowel or something like that. It's done in an operating theatre. It's done by extremely experienced and skilled surgeons, and that person is treated with the utmost respect and the utmost dignity. I do think that is one of the big concerns with families, and one of the bigger reasons why we do get no's sometimes. So it's important that people do know that it is a very, very dignified process.
And the whole process of organ transplantation, the receiver is vetted to make sure there's maximum chance of the organ being accepted.
Absolutely, yes. Before we go down the actual process, once we have consent from families that is something that they would want to proceed with, we do very, very rigorous checks to make sure that the organs are suitable for transplantation and that they will be used and matched to a suitable recipient.
Just one thing. Do you have in the wider community some resistance to organ donation because of their belief and their religion beside?
Within other religious?
Yes.
We've had sort of opposition within the Jehovah's Witness community, although again it's not a no within their religion. But I would have to say that I think the Muslim community is the biggest one that seems to be opposed to donation for whatever reasons.
Well, I'm moving on from there, right? I remember some time when we had Dr. Fakulty was saying that in a community, if somebody was to die because of, say, lack of blood being available, the whole community will be responsible.
Yeah.
Now that alludes to him saying that yes, we should actively be giving blood.
Yeah, absolutely. I think it's you'll be surprised. Many people actually think that giving blood, donating blood, is not allowed, or it's not something that is commonly done. So I think that if there are many people, people who are on dialysis and that kind of thing. I mean, the amount of time spent on dialysis is unbelievable. I met a brother who's actually working for BT, NHS BT, and he mentioned he spent 23 years on dialysis from the age of 20. And basically he was looking, and he tried everything. He even had one member, family member, who wanted to donate. For some reason, he felt it was not permissible at that particular time. He didn't go ahead with it. But he got to the stage, the 11th hour, he actually decided that, you know, he had no choice. So his nephew donated his organ, kidney organ, and that saved him. That completely changed his life. So something such as blood is something that we really, if we can donate, we should really be donating. It's not an issue really. It's our responsibility to do that.
It'd be negligent or even sinful for not to give blood, causing somebody to die.
Yeah, especially if you know someone is dying, is actually in need of that blood.
To yourself and
the most important thing we need to understand, I think this is where that needs to be. We need to educate the people, is that it doesn't. Your body in no way will be harmed through blood donation. Now, just going back to the issue about why is it permissible or not, and some of the issues I think you touched upon about that why people say it's not permissible. And one of the arguments put forward, it says that, for example, you know, the body belongs to Allah, therefore it is not for us to actually tamper with our body, our bodies. The scholars have given different views, but they have given one particular scenario that the fuqaha, the jurists, have said is permissible. If an individual is drowning or in the midst of a burning fire, it is totally permissible to go and save that person's life. So you're putting your life in a risk, but Islam does give permissibility. So this is a kind of, there's an analogy between saving someone's life someone that is in that situation, and the situation where he needs an organ, he or she needs an organ, and we can.
That's example you're giving. So the person going to go into rescue, knowing himself is going to get burned.
Yes.
But that burning or damage to the body is allowed because you're going to save somebody else's life. That's the key, that's the crunch point we say, aren't we?
Yeah. Another point regarding that is, for example, there's one particular Imam Shafi rahmatullah mentions in one of his books that if a pregnant woman died and the child in her stomach is still alive, then when it comes to, for example, mutilation aspect of it, then Islam says that we can open her stomach, cut her stomach open, and that will breach the sanctity of her body, but we're trying to save that child's life, so it's permissible. So that's another example of where the fuqaha have given permissibility, even though you kind of literally you're mutilating someone's body. So it's all about necessity. Necessity is the key point, and that if we're there to save someone's life, then we should help. It's our responsibility, really.
Rachel, what do you think the Muslims should be doing more in this organ donation?
Within your community,
Mm-hmm.
I just think we should be doing more to educate people, really, and to promote donation, and just to make people, you know, realise the statistics of how many people are waiting, and, you know, the likelihood that, you know, the chances are you're much more likely to need a transplant than ever be in a position to donate. And if you were willing to take an organ from somebody else, then, you know, you should think very, very carefully about whether you would be willing to donate as well. Because I think there is just a lot of ignorance really out there, for want of a better word, because people just aren't aware of what it involves. And it's just about educating people and making sure they know.
Maulana, we just had a question from a listener. Says, just wanted to clarify, is it permissible to give blood even if it is going to be stored in a blood bank?
Yes, that's how it actually works. You know, you put in, you donate, and it goes into a blood bank, and then whoever's kind of matches up with someone else's blood, then that's how we actually transferred. So it is permissible in that sense, yeah.
Well, going back to the earlier discussion you had, you mentioned that some jurists were using the 4 reasons why we can't give, and you've already refuted 2 of them. You gave the example about the burning fire, or the cause of damage itself, the fact of saving somebody's life. You talked about mutilation, about the deceased expectant mother, that there is some mutilation to her body, but saving the baby, again, so the sanctity of life overrides it.
Yeah.
The other 2 points you mentioned earlier on, do you have?
Yeah, I've got the points. The points I mentioned, the 2 points was about to do with every human being is honored by God. So Allah has honored every one of us. So therefore, we by acting in any way harming our bodies, we are dishonoring, violating, and breaching the sanctity of life. Basically, in reality, what we must understand that every life will be treated with respect. But the key thing there is about necessity, and there's many fuqaha who've given particular um, rulings. Put it this way: the principles of why it's permissible. So, for example, they say ahwanul balyatain, basically the lesser of two evils. Here you have a choice of saving someone's life, and maybe okay, in some ways, literally, you might be cutting someone's body, or violating, literally violating the sanctity of that body, but there is a greater good at the end of it, and which is saving someone's life. Another example they give is ad-daruratu tubihul mahdhurat. Basically, necessity actually mitigates prohibition. So if there's a necessity there, so the prohibition will be mitigated because of that necessity. So for that reason, the ulama have said, yes, every life is, is honored by Allah, has been honored by Allah, but out of necessity, we is allowed. For example, in post-mortems, those fuqaha have given permissibility on this basis. So this is how we will actually answer that particular question. The other one was to do with the fact that when it comes to did I say about have I mentioned about mutilation? Yeah, I mentioned about mutilation. The other one is about why, on what basis can you do this? Is there a particular hadith or anything to do with that? Obviously, there's many ahadith that gives or verses of the Quran, for example, man ahyaha fakannama ahya an-nas jami'a, that you save one person, okay, you're saving humanity. But the main point that the fuqaha have mentioned is basically al-dararu yuzal. Basically, harm must be removed. So through organ transplant, you're removing that particular harm that is out there. That's why they made it permissible.
Mother, you also mentioned, Malana, that if there's no other resort, that was the only resort left.
Yeah.
But also things like kidney transplantation in particular. I heard there's option of dialysis.
Yeah.
But the quality of life of a person who's on dialysis can be greatly enhanced if he was to get an organ transplantation.
Yes. Yeah. So I mean, it's about what the thing is from our point of view is we can't really understand how it is to live and have to suffer whilst being on dialysis. It's unbelievable. The amount of stress on the family and the quality of life a person has is very minimal, very minimal. So what we must understand is no one will actually give permissibility unless someone is in that dire scenario. And the situation is he's not going to get better out of dialysis. He's just going to, the person is going to eventually die. So out of necessity, if there is an opportunity to bring some quality to a person's life, why not allow it? And that's why the scholars who give permissibility say that they say what is wrong with that? Then that should be offered to that person.
Yeah, just adding to what you're saying, I think there should be more responsibility from our ulama in guiding our community, because sometimes, shall I do it or shall I not? We're in limbo. So do you think the ulamas are respected ulamas up and down the country that come together and give a certain direction, like yes, or say no?
I think as I said to you, I think it's about. I mean, I was as ignorant as anyone. I'm not suggesting in any way I have knowledge of this, fully grasp what this particular issue is about from an Islamic point of view. But I think that certain scholars are working on it. They're working on opportunities like this down the country. I know one or two chaplains in Manchester, in Bradford, and they're working on this, and they're actually going in the communities and educating people. So it's an ongoing thing that will actually take years, and it's not just a matter of coming on one radio station and explaining and people will actually agree with it. It's about educating, and people have questions. And I think the only way is to engage and allow them to ask those questions and allow us to actually discuss this fully for us to understand. I think the other thing is, I think working in a hospital setting, Rachel will mention, is you have a different perspective when you work in that environment, as opposed to when you're working away from. You don't see the day-to-day suffering that people are going through day to day, and then you have a different perspective. What do we understand about suffering when we are, enjoying the luxuries of this life and we're healthy and fine? But when you actually go in the hospital, you see these people day in, day out coming and on that treatment for years and years. You just see their lives, completely degenerate, completely come to a standstill, really. So it's from that point of view that we must understand. And that context we must really understand, and then be able to give a kind of a fatwa.
The time is exactly 9 o'clock. I think it's because of our program. The time's gone very fast. I think before we close up, Prisha, is there any final words you'd like to say?
Yeah, I think just, as Aslam was just saying, I think people don't think about it until it touches their lives. And when it does touch their lives, because a loved one does need a transplant, then people view things completely differently. So, please just try and think of it in terms of what would you do and what would you want if somebody in your family needed a transplant, and, think about how you could help people.
I mean, if someone wants to talk further and how would they what's the contact details, or did you just contacted the local hospital, or the?
If they wanted to talk to me in particular, then if they contact the hospital switchboard, they will be able to contact me. But there's lots of information on the internet. If you just type in organ donation, NHS blood and transplants have a massive information on there for people, and a massive information for the BAME community as well about what is permissible and isn't permissible.
Maulana, any last point from you, sir?
Right, I don't know if I've covered enough, because I think 1 hour is not sufficient to be able to actually discuss this issue. But hopefully we've kind of, from our point of view, touched upon some of the key issues, and hopefully individuals can read up on it. And there's many fatwas out there. My advice to you is read Mufti Muhammad Ibn Adam's fatwa on this issue. He's not given a direct permissibility or non-permissibility, but he's given some of the quotations from different scholars and allow the individuals to make that judgment. But looking at his fatwa, you can actually see that there's quite strong evidence to actually point that why it's permissible, and quite rebut some of the arguments are actually put forward for impermissibility. So from that point of view, we're moving forward, alhamdulillah. Things are changing. As actually coming forward here, Rachel and myself coming forward and discussing this issue is a stepping stone, hopefully, to taking this further in the future and educating people. The key thing is, if we are aware of this, then we know we can actually, for example, we can speak to someone within this, the Muslim community, or within the hospital setting. We can speak to Rachel and actually get a better picture, because there are thousands of people who are on the waiting list and they need some kind of support.
As you know, Mona, we have an in-house magazine program. So if you want to write something on organ donation, please let us have a write-up, and we will insert that in. I think it might be too late for this month, but for next month.
Yeah, that would certainly be good. Thank you.
Yeah. Thanks so much, Maulana and Rachel, for coming down.
Thank you.
It's a very difficult subject, and we can't do justice on this subject in just 1 hour. I think a whole weekend would not do it enough justice. But in a nutshell, what we say, Maulana, is that the sanctity of life, the value of life overrides the other factors, and therefore permissibility is allowed. I've got one paper here, and I don't like quoting, but it says on here, it was given at Islamic Fiqh Academy. And I'm just going to read it out word for word. It is permissible to take an organ from a living individual and place it in another individual who is in need of the organ to save his life, or to bring into use a limb which is from the necessary limbs of human. This is not considered as desecration in relation to the person donated the organ. It is considered as helping and aiding another in time of need, which is a praiseworthy action, something we touched upon earlier on. It will be permissible with the following conditions, and these conditions that you mentioned also. The donor's life is not endangered by donating the organ. The donor gives the organ with his free will without any pressure put on him. There is a high probability for cure through the organ transplantation, and the sickness is such that the only way for cure is through organ transplantation, which you mentioned. I think we also got to understand here, very important, is that again, please correct me, I'm not a ulama, far from it, but in time of hunger, pork and wine is allowed to save the person's life, which normally for us is a forbidden.
Absolutely.
So again, this sanctity of life, the important preservation of life, which comes into play, which makes organ transplantation necessity.
Yeah, absolutely. It's all about necessity, and the word in the Quran that's mentioned about necessity, just quickly, is فَمَنِ اضْطُرَّ. So when it's necessity, then many things like you said, pork or alcohol is allowed, limited is allowed, but again, the key thing is you're saving that person's life. I think Muhammad.
Yes, I just have got one question, and I will make this one as the last. It says the organ donation issue is something not often talked about because people don't like facing their own mortality. It's only when we have a situation in the family. How has it been tackled in the wider community? I think it must be referring to the Muslim community, I think. Rachel, you know?
I don't quite understand the question.
Yeah, I think how has it been tackled in the wider community in getting the information about organ donations?
I think across to people. Just through education and through adverts, through posters, through obviously people passing on word of mouth to other people, which is the same within the Asian community. But I think because there are these permissibility issues, it's, it hasn't evolved quite as much and people don't think and talk about it as much.
Yeah.
Mola, is there any?
I think I was reading actually in the internet in the hospital that it's actually organ donation week.
Last week
was it last week?
Transplant
so
week.
a transplant awareness week. So it's going. I think the government, as I said, they are trying to get that message across to all communities, not just Muslim community, but obviously we're coming from the Muslim community. I think that's where the need at the moment is greater than anywhere else. So this really is something that needs to be had more often. Opportunities like we have Pergam, or where it's just about educating, because people are not aware of organ donation, even transplantation. Because there are two issues here: transplantation and donation are two different issues. So I think educating people and then making them aware, and actually looking at the in-depth analysis from the scholars, from the jurists over the period of probably 30 years, you will actually see a huge change in their understanding of organ donation. And before, I would say they would have said outright not permissible, and the context has changed, therefore their view on this issue has changed also.
I think we'll call it a day. It's now 9:07. Thanks everybody for coming down. If there are any questions you would like to ask, by all means do text into us and we can get Mawlana to get back to you on individually. This is Dr. Imtiaz Patel saying Khuda Hafiz, fi amanillah, and assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Rachel, as well.
Thank you.
لا إله إلا